Every Wednesday, we've got Dr. Fahmi Farah joining us on the program, one of North America's best cardiologists. And very interesting story, the good timing on this. Dr. Farah, thank you very much for joining us on the program. And tell folks a little bit about your background. Welcome back to the show.
Thanks for having me. As always, it's a pleasure to be here. I am an invasive cardiologist, CEO and founder of Bentley Heart Medical Center, also director of Global Healthlines Foundation.
Okay, very good. Thanks for joining us here. I'm looking at a story in what is called the Daily Mail. That is a publication that's based out of London, but of course received all over the world. And they've got a story about a man who is obsessed with becoming a dad, and he has shed almost half of his body weight by eating a carnivore diet consisting of just meat and eggs in a bid to improve his fertility. Isaiah Caldwell from St. Louis, Missouri, tipped the scales at 434 pounds, but he's now lost a staggering 210 pounds, and he's started to make changes to his lifestyle after being told his weight might be causing fertility issues, and now weighs 224 pounds and feels, quote, 1,000,000 times better. Wanted to get your thoughts on this, on the carnivore diet. What does that consist of? Is that pretty much ditching everything that has not come from an animal, leaving folks with like meat, eggs, and dairy, that kind of a thing?
Yes, a carnivore diet, as it sounds, it's pretty much meat-based products. Even though he's been successful with the amount of weight loss that he's had, it's still not a diet that we would recommend for heart health reasons. Similar to, things like Atkins diet and, there are other diets that focus primarily on protein and fat-heavy diet. Those are not good for the heart because some of them are successful, they're good for weight loss, but at the same time they cause your cholesterol to go up high. Particularly this diet, like as you mentioned, eggs and meat, those are both very high in cholesterol and they're not good for your heart health.
Okay, and so maybe this is something maybe not to get involved with, in other words, right? I mean, because it sounds like maybe an all-meat diet could lead to maybe cardiac arrest. Is that a fair statement?
It is, yeah. This is definitely not a diet that I would encourage.
Okay, and when you mention cholesterol, when it comes to heart health, do most people simply just don't know what their cholesterol levels are? And without knowing what those levels are, that can really take a toll on the heart. How does that work, cholesterol levels and the heart, the functioning of the heart? How would that work?
So our body naturally produces cholesterol, but when we have diet that consists of high cholesterol, fatty foods, high meat products in your meals, that causes the cholesterol level to go up. And cholesterol is one of the key ingredients in plaque formation. So when we're talking about blockages in the heart, that's what leads to a heart attack. Cholesterol is one of the key factors, and that's why we care about it so much. We want the cholesterol to be low and not high.
Okay, and take that a little bit further, because say somebody is rushed to an emergency emergency department, and they're having, say, heart issues out there, and then determine that maybe there is a blocked artery or two. How would you treat that? Say if somebody's in an ER status, maybe medicine, or how would you work that to begin with? What would happen there?
Sure, and somebody can be in the emergency department for a number of reasons when it comes to the heart. One could be heart attack, and of course they would present with chest pain and shortness of breath. And if it is a heart attack, in addition to medicine, we would also take them to the cath lab, where we would actually go inside the heart arteries, the coronary arteries, and take a look to see what the blockage looks like. And if it is a significant blockage, then we would actually manually fix it by putting in a stent. So that's called a cardiac catheterization. That's the procedure. So it's a combination of both medications and the procedure to fix the problem. That's in the setting of an acute heart attack. On the other hand, there are some chronic, chest pain as well, like people who have chronically been experiencing chest pain, they can come to the emergency department with chest pain that's not heart attack. Even in that situation, if somebody who's not having a heart attack, we can run a normal routine test to make sure they're not having a heart attack. We can do a stress test, and if the stress test is abnormal, then that's another indication when we would be taking that patient to the cath lab and performing a procedure, same procedure, and as cardiac catheterization, and fix the problem, which is a blockage if it's there.
All right, and interesting when you mentioned somebody who's diagnosed has a heart attack, does this mean that they are also likely to maybe suffer another heart attack at some point?
Yes, they are. So if you have a heart attack once, you're at risk of having another heart attack. So that's why you're supposed to be under routine care of a cardiologist.
Okay, very good. And when a situation develops with the heart, and I think it's called sudden death syndrome, where the heart just completely stops. If you had like one or two heart attacks, could, say, a driver, listener, be susceptible like to a sudden death syndrome situation here? What is that exactly, sudden death?
Yes, it's called sudden cardiac death, and that can happen for various reasons as well. Of course, the heart being the number one cause. People who have had prior heart attack are at much higher risk of having that. People with blockages that are untreated are at risk of sudden cardiac death. Also, people who have congestive heart failure, if their heart pump is not functioning well and they have heart failure, they're at significantly increased risk of having sudden cardiac death. There are certain rhythm problems as well. The heart has its own electricity, and the heart is meant to beat in a very regular manner, but there are certain anomalies that people can have where they have arrhythmia, where the heart rhythm is not normal and it's beating erratically. There are various different types of arrhythmia, and some of those could be dangerous, such as ventricular tachycardia, where the heart just beats very rapidly and it can go into cardiac arrest and cause sudden cardiac death. So, and of course, there are other reasons like congenital heart disease as well that can make somebody be susceptible to those as well.
Doctor, the listenership mainly going to be over-the-road truck drivers that lead very much a sedentary lifestyle. I know many try to exercise and to eat properly, but it's a difficult regimen being out there on the road with their responsibilities. They've got a 14-hour federal duty cycle and then an 11-hour driving time window, which is mandated by the federal regs. And many have said, well, I just don't have time to get out there and exercise and do what I need to do because I got to keep going out there. And this is just kind of a general question. Should more and more companies be cognizant of the fact that maybe based on, say, hours of operation, that they're putting their population or their workers at risk by not factoring in such things as sedentary lifestyle or movement on the job?
Oh, absolutely. Sedentary lifestyle is a very big risk factor for cardiovascular disease. So activity is very important, and inactivity in itself is a risk factor. So yes, I do believe that that is a risk factor and that should be mitigated.
Okay, very good. All right, doctor, let's do this. We're going to do the commercial break. Drivers would love to get you on board. Dr. Fahmi Farah is on, one of North America's most recognizable names when it comes to cardiology. And, man, I'm a big fan of this. And the reason being is that the more medical information we can get out there to you, you can have a better understanding as to what you are going to be going through or maybe what you've gone through. Like if you are in a situation where you had a heart attack before, I'm sure you're on some kind of a medication regimen, you're eating properly, at least trying to get the proper exercise and the amount of sleep is also good as well. You've got to make sure you get the plenty of rest that you need. We're going to talk about fads in some of the diets out there, like some of the over-the-counter or maybe some of the things you buy through Amazon. Could those things maybe create cardio or heart issues as well? Dr. Fahmi Farah is on with us, and we're talking about heart health, heart awareness, understanding what that thing in your chest is doing. It's keeping you going. And, man, if there's any problems or irregularities with it, like an irregular heartbeat, or if you're just not feeling well, that's probably a call to the ER. Get your doc on the phone and let them navigate you through all of the complexities with this. And, Doctor, again, thanks very much for joining me on the show. to talk about this. Everybody knows the name Amazon. You can go to Amazon and buy pretty much everything. You can buy, shoes. You can buy, say, televisions, radios, things like that. I mean, everything is up there. And when it gets into the area of buying stuff, say, through Amazon or maybe another site that deals with, say, maybe a cardio boost. Take this pill and you're going to feel like the day is going strong. Just download, click here, point, then it's on your front door, and it's got a real fancy name on it. But it may not have the best of ingredients that may be inside of that. Doctor, what would you say to that about maybe somebody buying a supplement or a stimulant, like a caffeine pill, things like that? Be wary of that because you don't know where this is coming from.
Oh, absolutely. Anytime you're putting something in your mouth and you're ingesting it, you have to be careful what the source is. And while Amazon is a very convenient place for all of us, you do have to be careful about what you're ordering and figuring out where that's coming from. When it comes to supplements, I will say a lot of these are not FDA approved, and as a result, the quality control is not there. So we don't know how much of what's in there and what the interactions could be with other medications, what the side effects are. So, yes, caution is definitely advised.
Okay, and interesting you mentioned the side effects. When I'm watching some of the television ads that, hey, try this product, ABCD, that takes about 5 seconds, but for like the rest of the commercial, or maybe at least 50 more seconds, it's all about the side effects. So when somebody's maybe doing something like that, or maybe say they're trying an over-the-counter medication, they need to be concerned about the side effects on their heart. Correct, Annette? Is it all interconnected there?
Yes, I definitely agree with that, especially for those who have pre-existing heart conditions and they're on certain heart medications, such as blood thinners and things like that. They could have major interactions, and so you should run that by your physician before you take anything that's over the counter.
Okay, absolutely. And your pharmacist is also a good spot, right? If you don't, maybe your doctor is not available at the moment, but maybe the pharmacist is. They're a great resource as well, aren't they?
They are. They are very much the experts of medicines themselves. They are very knowledgeable when it comes to the indications for medicines and the side effects, especially interactions with other medications. So they're a very good resource, and they should be utilized.
Okay, absolutely. And you mentioned the Food and Drug Administration, the FDA. Many people have seen the 3 letters, or they've heard, the words Food and Drug Administration. So just in putting it in terms, this is the agency that pretty much regulates everything that goes on with the body. Everything you put in your body as far as food goes, medicine goes. Is it a huge governmental agency that monitors all of these things, especially when it comes to the heart?
That is correct. Any kind of food and drug related matters, they are the quality control. They ensure quality control. And so anytime you're taking supplements or over-the-counter materials that are not FDA approved, that automatically means that we don't know what the quality control of that is. And so we do need to be careful.
Okay, very good. I just had a Facebook message in from a lady by the name of Jill. And, Jill, thank you very much for writing this. She says she had a stent put in about 5 years ago, and she says, quoting, "It's made a world of difference. Please pass this along to Dr. Farah." So the stents, that has saved many a life for those that are experiencing heart issues. What does that do exactly with a stent?
Yes, a very good question. So earlier we talked about having a blockage in the heart. Those blockages form in the coronary arteries, in the blood vessels that supply blood to the heart muscle itself. And so blockages are what, when you have a blockage, it's like a pipe. The blood flow decreases, and so the amount of blood that's reaching the heart muscle decreases, and as a result, people can have symptoms like chest pain. Those can also turn into heart attack and even heart failure. That's one of the major causes behind that. So what a stent does is when we go inside the coronary artery, we locate the area, the exact location of where the blockage is, and what's considered a major blockage is 70% or higher. So once we get in there, if we see that, yes, there's a major blockage, then we utilize a device called stent. We basically place the stent where the blockage is, and we deploy the stent in that location, and that opens up that blockage, and it actually restores blood flow back to normal again.
My goodness. All right, and does that mean a shorter recovery time when a stent is in?
It's very short recovery time. The procedure itself is extremely simple. We do all our procedures, it's a percutaneous procedure, so of course it's not open heart surgery. I do all my procedures actually through the wrist. A lot of people do it through the groin. So the whole thing takes about 30 minutes to do, and then the recovery time is just 24 hours. So so technology is amazing now. So I am very grateful to the person who wrote this message. This is a very big educational point for a lot of our listeners.
Oh, absolutely. Jill, thank you for that. I really appreciate you writing in. And, and again, it's going to get down to, Dr. Farah, the quality of life. When someone thinks, okay, maybe if I get a heart attack or if I got to get a stent put in, my quality of life is going to go downhill. That's not the case, correct? And most people can maybe resume normal activity in their life.
Oh, absolutely, yes. You're so correct that a lot of people are afraid of coming to the doctor and getting a stent in. They think that it's going to affect them. It's the contrary. It's quite the opposite. Stents can open up the blood flow and restore a function back to normal and basically give you a normal life again. In many cases, it can increase quality of life as well as increase survival. So those are not just life-saving, but also, give you the quality of life that you deserve to live with. One point I will make is a lot of times people have, blockages typically form chronically over years. And so their functionality also goes down gradually. So a lot of times people don't realize that they're not really functioning at their optimum level. For example, their stamina is just not as good. They get tired all the time. They may not have chest pain, but, they just can't continue doing what they used to be able to do a couple of years ago. And it happened over such a long period of time that this becomes baseline, and so they don't recognize that this is a problem until we go in and fix it. And when they get that function back, they're like, wow, I can't believe I lived like that for so long. So,
wow.
Yes, quality of life is a big deal.
That's an amazing story when you think about it. You know what would be interesting, Doctor? I'm just going to throw this idea out there. Maybe for the next time, have one of your patients that has got a stent, and have them talk with you and on air with us and tell people what they're going through. Maybe at some point we can do that. That would be bringing the story a little bit further. And the important thing is to getting that information out there. Doctor, thank you very, very much for joining us on the program. Dr. Fahmi Farah on board. And she is one of the best cardiologists in North America. Highly recommend if you're thinking about getting into an exercise program, ballroom dancing is the way to go. And Dr. Farah has won championships on that. And, Doctor, thank you very much for jumping in. Let's get your contact points out again. Where can folks find you? What's the best way?
Thank you so much, Willis. You can find me at www.drfahmifarah.com. You can also find me on social media, Instagram and Twitter at Fahmi J. Farah. Also my podcast channel, All About Heart, at Queen of Hearts Podcast.
Outstanding. Let's do this real quick. I've got about 1 minute left. Big Fat Daddy, quick question, and I got to let the doctor go. You're on with her. Go ahead.
Yes, you just started mentioning quality of life. I'm one of those type of people that I love a good Big Mac. Now, I don't necessarily have to go to McDonald's to get it. I can make it at home because the secret sauce is only Thousand Island dressing or some variation of. But doesn't eating something that some would find questionable fit into quality of life?
Okay, I got to let you go. I've only got about 40 seconds left. Big Mac attack, Doctor. What do you think? About 40 seconds.
No, unfortunately, Big Mac is not a good idea, and that would not serve well to that quality of life that we're talking about.
Okay, very good.
Unfortunately not.
BFT, long-time listener, good friend of the show. Doctor, thank you very, very much for joining us on the program. That's Dr. Fahmi Farah on the line with us, and we'll do this again. I appreciate you very much.